is to go through questions that folks have coming out of Monday's presentation on the designation application for children's SPA and HCBS. If you weren't able to make it to that following the office hour today, we'd encourage you to visit mctac.org, where you can view a recording of the presentation and access the slides. Today we'll be specifically addressing questions both that came through on Monday and ever since. And also, I'd just like to highlight we've been receiving questions already since going live with the webinar this morning, and we'd encourage folks to continue to send in the questions as we go through, and we'll do our best to address as many things that come through as we can. So quick housekeeping, this is probably not folks' first time at the rodeo in terms of joining for webinars, but just in case, especially because of the format of an office hour, please do chat in your questions on the right-hand side of the webinar platform. You can open up a chat box. Our one request is that if you can please send to all panelists. That way the state presenters and MCTAC staff who are on the line can see all the questions together despite not being in the same geographic location necessarily. So we really appreciate that. So again, we'll get through as much as we can today. Questions not addressed will be reviewed and incorporated into future trainings and presentations, as well as added to the various Q&A resources when possible. And so just a reminder, information and timelines are current as of the date of this presentation. So if today is March 15th, 2017, and you're viewing this as a recording, please just keep that in mind. So we've got a robust group of panelists representing the state agencies today, including Tiffany Battles from OMH, Meredith Ray-Labatt from OMH, Marie McEwen from OASAS, Allison Bahan from OCFS, and Lisa Fiato and Alyssa Slezak from DOH. In addition, I'm sure a few other folks sitting around the table and in the background there as well. I'm Dan Ferris from the McSilver Institute for Poverty Policy and Research and the MCTAC team. I'm also joined on the line today by Yvette Kelly and Caitlin Cronin. And with that, I'm going to pass it over to OMH to talk about some updates to the children's timeline.
Great, thank you, Dan. So good morning, everyone. This is Tiffany Battles from OMH. And like Dan covered before, we had a lot of information on our Monday webinar, so we are very glad that we have an hour designated for today to talk about designation questions. So we really wanted to open up the office hour with a slide on our children's timeline. There were several questions received on the overall timeline, and as stated on Monday's webinar, the status of where the state is that we are seeking approvals from the Centers for Medicare and Medicaid for both our 1115 waiver and our state plan amendment. Given where we are in this process and the anticipation of new administration, we wanted to highlight a few updates regarding our timeline. The state is going to remain committed to moving forward with our children's design. Anticipated timeline for implementation of the full design runs through January 2019, and this is including our voluntary foster care agencies transitioning in January 2019. Depending on timeframes for acquiring necessary approvals, and these are the approvals of our SPAs and our 1115 waiver, dates may need to be modified accordingly. And we will continue to move forward with finalizing any design documents, policy, et cetera, as much as implementation work needed as efficiently and judiciously as we can given uncertain timeframes. And there was a question in regards to the status on where we are with our SPAs, and we are announcing that our SPAs have been submitted to CMS. This will be implementing the 6 new SPA services, and approval of SPAs and the 1115 waiver continue to be linked in one package, and our SPAs are actually now posted to DOH's website. And we also wanted to just address that regarding our provider designation application, we did release the application on December 21st, and that can also be found on DOH's managed care website and the children's website. and all the links to this information and all the accompanying tools that providers can use for some information as they think about applying can be found on the slides for designation that we reviewed on Monday's webinar, and that's on MCTAC's website. We also wanted to just remind folks, there may be some folks on today's call that weren't able to join us on Monday, that there's been questions about our initial deadline that we initially stated was February 1st, and that is now extended to April 1st of 2017. And our message to folks on Monday was that because of this extension, we really want to advise and strongly encourage that folks, again, familiarize yourself with the application, take your time to review it, take your time to review any of the tools that accompany it, and do not rush to submit. New York State will not be moving forward with any reviews until after that April 1st date, so we just want to kind of calm some of the anxiety out there and just really just take your time. So with that in mind, we're going to kind of jump right into the questions, and we received an array of questions. So what we've kind of done is we've bucketed them into categories. So there were several questions on our SPA and HCBS services, so I think we're going to start by addressing the questions received on our SPA services. So our first question that we received, and before we get into it, I know we do not have a slide up for the questions, but anything we discuss today, any questions that we review, we will put it into a document of some sort, an FAQ document, and we'll post it online. So, you know, please don't feel like you have to kind of write word for word what we're saying. We'll definitely have a guidance document out there for you to refer to. So we'll get started with our SPA questions. Our first question is discussing our psychosocial rehab service under our SPA, and how is this service different from the OCFS B2H skill building service, and a follow-up on how does it differ from the HCBS habilitative skill building service.
Okay. So first, this is Meredith Ray-Labatt, by the way. Please keep in mind we have all of our state agency partners on the phone today. Unfortunately, we're not able to all be in the same location. So please bear with us. This might be a little clunky as we have representatives come in and out of the discussion, but we're going to try as best we can to answer your questions, and if there's any additional content that individuals who are on the phone of the panelists that would like to chime in, feel free. One of the things that you'll note, and this is a fabulous question, and it actually was asked a number of times. So I'm going to say it once, and then it will address a number of the questions that were very similar throughout the chat the other day. The psychosocial rehabilitation service under the state plan amendment is a rehabilitative service. And what that means is that you are rehabilitating someone back to their original capacity and their original state. So the intent of PSR is to rehabilitate or provide rehabilitation to a child once on a skill that they once had, but they lost due to their mental health need, their behavioral health need, or whatever has been identified and diagnosed with that child. And the skill building activity, the PSR, is intended to help them to relearn that skill and to acquire that skill again. Conversely, the skill building, habilitative skill building that's listed under the HCBS service is habilitation, which is that you are teaching someone a skill for the first time that they have never required and never had, and that whether it be due to a disability or a developmental delay or whatever it may be, they need to learn that skill for the first time. So the difference between PSR skill building and habilitative skill building under the HCBS service is the idea of rehabilitation versus habilitation. Would anybody like to add to that? Great. Hope that helps. So again, there was a question in regards to the OMH skill building. OMH skill building today has a very broad definition under the HCBS waiver. Moving forward, it will be the same as I described. When we move to psychosocial rehabilitation services under the SPA, the delineation will be much more clear and much more purposeful in regards to how the skill building activities are applied to the individual child for the purposes of treatment planning and the development of medical necessity. So when PSR is available and habilitative skill building then remains under HCBS, it will align with what I just described, which is the difference between those two services moving forward.
And this is Allison from the Office of Children and Family Services. I just wanted to jump in because I know somebody mentioned Bridges to Health, and I fully support and agree with the way that Meredith had answered the question. I actually went to talk and I hung up on the phone, so I apologize if there was a pause there. But absolutely, OCFS is very supportive and in agreement with just the way that Meredith captured the difference.
Thanks, Allison.
Okay, our second question is in regards to community psychiatric supports and treatments, CPST, and I think this was in regards to just wanting some clarification on the individual qualifications to provide this service. So for CPST, the individual qualifications are as follows. At least a bachelor's degree level with a minimum of 2 years of applicable experience in children's mental health, in addiction and or foster care, child welfare, or juvenile justice. Also under CPST, individual qualifications may include a practitioner with a master's degree level in social work, psychology, or in a related human services field, plus 1 year of applicable experience, or who has been certified in an evidence-based practice. So there are also, there was a comment that there's also licensed individuals that are kind of listed within the CPST qualifications. Those licensed individuals include the registered professional nurses with 1 year of behavioral health experience, licensed occupational therapists, and the licensed creative arts therapists. And these were listed because there may be licensed individuals providing CPST. This was kind of an example of what some of those licensed professionals may look like. But CPST, primarily it's a bachelor's or master's degree and in a related field. Okay. So our next question is, can we summarize the differences between SPA and HCBS?
Sure.
Okay.
Or you got it?
If you...
No.
Okay.
Go ahead.
Chime in if I'm missing anything.
All right, good.
So our SPA services will be under our early and periodic diagnostic and testing, our EPSDT benefit under our state plan. And these services are available to all Medicaid-eligible children under the age of 21 who meet medical necessity. We want to note that SPA services are rehab services, meaning that the child once had the skill and lost it, so the intent of these services are to help restore that skill and restore the child to a previous level of functioning.
That applies to, that applies to 4 of the 6 services. So technically OLP and crisis intervention are not rehabilitative services, but youth peer, family peer, CPST and PSR are considered rehabilitative services.
Right. With our HCBS services, so as our 1915C waivers are transitioning under the 1115, HCBS services will be available in managed care. And these services are designed to allow children and youth to participate in a vast array of habilitative services. And this grants them access to a series of Medicaid-funded services. So HCBS are really designed for children and youth who require a level of care provided in a more restrictive environment, such as in long-term care facility or psychiatric inpatient care, and for those at risk of elevating to that level of care level.
Right. The only other, in order to be, unlike SPA services, wherein you need to meet medical necessity criteria, for HCBS services, you must meet target, risk, and functional criteria. So if you meet one of the target populations and if you have a significant risk and your functional levels are low to a certain point as determined by the CANS New York, you can be determined to be eligible for HCBS. And you can do so either if you're Medicaid or non-Medicaid, going through the state identified process for family of one. So. Great.
Okay. Any of our state agency partners on the phone have anything to add to that? Okay. So we had one more question under spa services. So there was a question under OLP, are licensed providers relieved from establishing medical necessity for adults and caregivers before providing services in the home? So
it's a confusing question.
Yeah.
I think what somebody's asking is in regards to off-site services and the need to establish a rationale or a reasoning why they wouldn't be able to provide the service, let's say in a clinic setting. And what I would say is that the actual intent of OLP is for them to be provided in a home and community to meet the child and families where they are in their natural environment. So unlike licensed behavioral health practitioner associated with clinics, there isn't a need to establish a reason for why the service couldn't be provided in the clinic. OLP is a separate, completely different service that really is intended to be provided in the home and community. Do you have anything to add to that, Lisa?
Yeah, this is Lisa Clark with OMH. So just OLP services are only available for children. So an OLP would only work with an adult or caregiver as a collateral in support of the treatment for the child.
Right. So hopefully, I mean, the question was a little bit unclear, so hopefully we've answered it to folks sufficiently. And if folks have additional questions or that wasn't the intent of what the question was, please feel free to resubmit through the chat box, and we'll be happy to answer your question more clearly.
Okay, great. Okay, so our second topic that we noticed was there were a lot of questions on HCBS. So our first question is, for kids who do not qualify for health home care management as a Medicaid state plan service, which requires Medicaid eligibility, will more guidelines be forthcoming regarding care management through the new 1115 waiver as a health home look-alike service? For kids who require a deeming process to view them as a family of one.
So this is Faith Schlesinger from DOA, and currently we are having resolution discussions regarding care management for those that are going to be under the family of one eligibility, who are either ineligible or not currently, or opt out rather, of the health home program. And we'll certainly be sharing further guidance as that's developed in terms of who's going to be serving that function, but it is under state designation at this time to be able to resolve that issue, and there will be further guidance forthcoming shortly.
Okay. Our second question is, could you describe the specific distinctions between habilitation and habilitative skill building services? I can do it.
Yeah.
Okay. So the habilitation service assists the children and youth with developmental, medical, or behavioral disabilities with self-help, socialization, and adaptive skills, which are necessary for successful functioning in the home and community when other types of skill building services are not appropriate. With our habilitative skill building service, this focuses on helping the child youth to be successful in the home and community as well, but it's by acquiring, developing, and using both social and environmental skills associated with his or her current developmental stage. With this service, it's intended to assist children and youth to acquire skills that did not progress along traditional developmental trajectories due to their disability or diagnosis. And with habilitative skill building activities, good examples of what some of these activities could include would be teaching a young person how to shop for food, or how to distinguish what type of clothing is appropriate for weather, going to the laundromat and teaching them how to wash their clothes. So it's very hands-on activities within the habilitative skill building service. If any other state agency partners want to add anything to that, please feel free to do so. Okay. Our next question is, can you go through and explain the HCBS final rule?
Allison, might you be able to speak to that?
This is Alyssa Slezak from the Department of Health. I can speak to that if you guys would like. So the HCBS final rule is a regulation that was developed by CMS. It was effective March of 2014, I believe, and this regulation basically says that in order to receive HCBS, individuals need to be in applicable settings. So there are different rules and regulations about the types of settings that people can be in when they receive HCBS services, and there are requirements about things like are there locked doors, do people have access to food, can people kind of come and go as they please. So this would all be on the CMS website. So if folks were interested, they can certainly go there, and we can link to that when we do, any formal write-up of these Q&As. But also the rule speaks to something called conflict of interest, which is that there needs to be separation between provider agencies that provide care management and HCBS services. At this point, the state has not issued any guidance related to children's services and conflict of interest, but that will be forthcoming. I don't know if anyone has anything to add.
No, I think that was very helpful. Thanks, Alyssa.
Thank you. Okay, so our next question is, when will the children's waiver application be available for provider agency review? This was another question that was a little unclear. We interpreted it as the designation application. So if it's, if this particular provider intended as a different question, please let us know through the chat function. But the designation application was made available at the end of December, and that can now be found on DOH's Children's Managed Care website. So please, make sure that you access that, and the slides, as we mentioned before, are also available on MCTAC's website. Okay. Our next question is, can we please clarify what is considered institutional placement?
Again, we're assuming that is in reference to the kind of risk factors identified for qualifying for HCBS services regarding level of care. In order to, similar to today, in order to qualify for HCBS eligibility under level of care, a child or youth has to be at risk of institutional placement. Those institutions are considered hospital levels of care, so hospitals, nursing facilities, ICF, IDDs, restrictive, inpatient type settings are institutional placement as per the Centers for Medicare and Medicaid. So I hope that answers your question. Does anybody have anything to add in regards to that? Okay. So for the purposes of HCBS level of care, the child would have to be at risk of needing those levels of care, meeting those levels of institutional placement, but in order to maintain them in the communities and in their homes and in their school environments, they would need to, they would be eligible for HCBS to avoid institutional placement.
Great. Thank you, Meredith. Okay, so we're going to move on to some questions pertaining to our overall designation process and the application itself. So our first question is, can Article 31 clinics opt out of applying for SPA services as a standalone clinic, or must they convert?
So there's, just to clarify this, Article 31 clinics are not going to be directly impacted by any of the SPA services. There's no conversion. That program in and of itself will remain intact as it is now. The SPA services will not be provided through the Article 31. An agency that has a clinic can apply and be designated to provide SPA services, but the clinic itself won't be providing those services. The services will be separate from the clinic.
So there's no need to opt in or opt out. It's not required. You can apply as an agency, but you don't need to, and nothing's converting. Nobody needs to convert anything.
Right, there's no conversion. So for clinics, I said it doesn't directly impact you, but the thing that you'll need to know is your clinicians need to be aware of the new services so that they can then write and kind of authorize these services into their treatment plan, so then SPA services can be provided.
Okay, great. Our next question is in regards to EBP. Will there be a separate application for EBP designation for CPST?
Which is evidence-based practices.
Evidence-based practice. The answer to that is yes. In order to provide EBPs, applicants must be designated as a provider of CPST and or OLP as well. And EBP designation will be forthcoming. That's something that is still under development. However, we want to note that that whole designation process is separate from this designation process. So that is noted within the application, and as more information evolves with that whole process, we will be sure to let folks know and, push any guidance out there. But yes, it will be announced at a later date, and it is separate from this designation application process. So stay tuned for that. Okay. Our next question is specific to a B2H provider. So they're a B2H provider and also applying to open in Article 31. How will we go about handling this?
So I think the problem, I'm sorry, Tiffany, I think the problem is that they had a problem with their OMH number application, and so they said there's a delay.
Oh, okay.
So if that individual agency could please email the provider designation inbox, the staff managing that inbox would be happy to follow up to identify what the delay is and provide any additional assistance and support that they can provide to you.
And this is Allison Bien, because this question was raised by a Bridges to Health provider. I would just caution folks, if there are agency-specific questions, this should really be handled directly with the state agency folks that are on the phone. These webinars, they're intended to give out broad amounts of information that apply to a number of providers, but this is a very, very specific question that we'd be happy to handle, specifically with the provider.
Yes, thank you, Allison.
Perfect.
Okay. Our next question is, do designation adult HCBS providers need to reapply for children's designation? The answer to that is yes. Our children's application sits on the same database as the adult HCBS application. So as we discussed on Monday, because it sits on the OMH portal, all applicants who intend on applying will need an OMH user ID and a facility code established. So if you were designated as an adult HCBS provider, you should already have these credentials established to access the application, but you will be required to go into the application, complete it, and submit it for children's designation. Okay. There was a question on clarifying question number 7 under our service information tab. So what I did was I kind of went into the application just to reference what this question was. And this is a general question that asks the applicant to, if you do not have related experience with any of these services, please explain how you think your agency would meet qualifications for delivering these services. And for clarifying this question, this really speaks to some of our current 1915C providers today may have some experience with some of these services that are moving either under our SPA or HCBS. For example, some of our 1915C providers under the OMH FCD waiver may have experience with our family peer support service that will be moving under our SPA, or some of our current providers under the 1915C waivers may have experience with pre-vocational service or skill building. So in the case that a provider who is applying may not have that direct related experience, this question kind of gives you the opportunity to speak to other services that your agency currently delivers or other experiences that you may have that are alike to these services, and it gives you some flexibility to kind of give the state an idea of what your expertise is or how you may have had somewhat related experience regarding these services. So that was just some clarification for question number 7 and specifically. The next question was, if an agency does not indicate current intent to provide other HCBS services or expand catchment areas covered after the designation process is complete, will those agencies be able to seek a future designation to provide additional services and or expand geographic areas covered? The answer to that is yes. The agency should be able to reapply and or go into the previous application that they submitted, and we can unlock it and you can kind of go in there and update it. The hope is so that agencies do not have to go and complete a whole new application again. So yes, you can reapply. To do that, you would just have to go into the application that already exists and update that information accordingly. All right, our next question, does rolling basis mean you will accept applications after April 1st? Yes, the provider designation application process does occur on a rolling basis. The deadline of April 1st, it's really intended to be our initial deadline for those applicants that want to apply in that first round. So it's really starting that date that we're going to kind of close the application pool for a little. New York State's going to begin to start that review process. However, any applications received after that April 1st date, we are absolutely going to review as well. It'll just be reviewed as they come into our designation mailbox. Okay, there was a question requesting, OCFS did go over a slide during the Monday's webinar, particularly pertaining to voluntary foster care agencies. We can absolutely reiterate that information and put it within an FAQ document that we're going to push out. Allison, I didn't know if you wanted to add anything to that.
No, I agree with you, Tiffany. So Mimi Weber from the Office of Children and Family Services and I spoke about how this information will be articulated in the written FAQs that are released on the MCTAC website. So it will be forthcoming.
Okay, great. There's another question, what additional licenses will be needed for practitioners within voluntary foster care agencies?
And this is Allison Bean again from Office of Children and Family Services, and we want to let you folks know that the Office of Children and Family Services is actively working on the information that voluntary foster care agencies will need to be aware of regarding licensure of practitioners. But it's important to note that this licensure really applies only when children in foster care are in managed care and the billing is through the managed care plans. So this does not apply to foster care agencies in the current state they have of Medicaid fee-for-service billing.
Great, thank you, Allison. Okay, so continuing on with some designation questions. In regards to site location, should an agency additionally account for any satellite offices that will serve children with SPA and HCBS services? And is there ability to add multiple sites to the application? If the agency intends on providing services out of a particular site location and even beyond that location in the community, it should be listed on the designation application. So the application does have the ability for the agency to list multiple sites. And what I wanted to mention to folks is that we do have a guidance document with screenshots of the application, and it kind of give some clarification on particular prompts and particular functions in the application, we can absolutely finalize that and polish it up with our state agencies and also push that out as guidance. I think it would be helpful to folks as they follow and review the application. But to add multiple sites, you would go to that site and staffing information tab, and there is a function that is titled Add New Site Location Record, and what that allows the provider to do is that they can enter in a whole new site and be very specific about the counties that that site serves and whether and how they intend on providing services beyond that site in the community. So that is a capability that the application does have. And I just want to note that every time a provider enters in a new site, they are required to also speak to the staffing structure for that particular site location. Okay. So we're going to move on to some technical assistance questions for designation, just kind of regarding the function of the application and the user IDs. So provider asked if we already have a user logon and password for the adult HCBS completion, do we need to get another user ID for children's services? And I think I answered that before. So if a provider previously applied and to be considered as an adult HCBS provider, those credentials that you use to access that database should work for the children's application as well. The difference would be that once you get into the site, there are 3 options, and you would select the children's provider designation application. We also had a question, due to delays in obtaining security tokens to access the OMH site in order to access the application, will you be offering additional office hours for questions about the application in addition to today's office hours? We do know we're going to do an FAQ, and we're going to, take time to make sure we can best answer any questions received today that aren't covered today as best as we can, and the FAQ document will be out. And if we do feel like the office hours are helpful, we can certainly schedule some more.
And there's a provider designation email box.
And there is a provider designation email box as well, yes. So if for some reason folks do not get a chance to enter in questions in the chat box today, you're certainly encouraged to also utilize our provider designation mailbox. And like we stated before, if you're a provider agency with a very specific question, we do advise that you email our designation mailbox and we can delegate that question to the appropriate state agency. In regards to addressing the delays in obtaining the security tokens to access the application, we did follow up from our IT folks, and they have responded that tickets were placed to be processed, and that was at a record pace as of yesterday, so it should not be an issue for any providers that submitted tokens. Your request should be processed and going through as we speak. So if for some reason providers are still waiting on that, again, please contact the designation mailbox and we can communicate with IT to see how we can keep that moving for you. In regard to the application, do the open text box fields that we have within the application have a word limit? Yes, they do. All open question text boxes allows for a maximum of 2,000 characters. For the rest of the text boxes, it depends on the field and the questions that are being asked. So for a field that asks for the provider's name or the address or the city, the character limit is going to be less, of course. But if it's an open question where the provider has the ability to answer, it's about a limit of 2,000 characters. So just keep that in mind as you're answering some of these questions. Our next question is, there is a print entire application function that a provider stated does not work, and is there a way around this? So we kind of talked about this on Monday's webinar. Because there's a lot of information in the provider designation application, we encourage providers to print the whole application and have a hard copy and kind of review it so that you can feel prepared when answering some of these questions. We pointed out that the print entire application function is on the very last tab, which is titled the attestation tab, and you do not need to enter any information. When you go to this function, you can click on it, and what it will do is it will pop up as a PDF version, and it'll state that this application is not complete, and it will show just all the blank fields of the application, and the provider can review it in that way. I did follow up with our IT folks, and the function was working and it's enabled as of yesterday. So if for some reason a provider is trying to print the application as a blank copy just to kind of familiarize themselves and they're still having issues, again, please contact our designation mailbox and we can reach out to you individually and kind of help you through that technical assistance. So our next topic is discussing some Medicaid provider enrollment questions. And our first question is, would you recommend that an agency apply for a new MMIS, which is the
Medicaid provider number?
Yep, and the MPI number, which is the National Provider Identifier number. If they intend to add this as a separate line of business than they currently operate, or is it best to just keep one?
If you do apply for a new MMIS and MPI number, you're going to have to fill out the whole provider enrollment application and submit payment again. So it is easier if you just keep one. You can get ETIN numbers to keep track of your separate lines of businesses.
Okay, what number?
ETIN.
Can you just, how do you say that?
ETIN.
Okay, ETIN numbers.
And that will be a way to be able to separate, to track your reimbursement separately.
And what are those numbers?
It's free. It's just a form you have to fill out on the Medney website. You fill out the form, send it in, and that's the recommended way to be able to track reimbursement separately.
Okay. There was another question on how do you choose which MMIS number to use?
You can really choose whichever one you want to use. The only thing is with the category of service that we're using, you need to have an MPI associated with your MMIS number. So I know some of the current providers, the waiver providers, are atypical and they don't have an MPI associated with their provider ID number. So it is best to use a provider ID number that has an MPI associated with it.
And we want to note that a lot of these questions that are asked are going to be reiterated in an upcoming Medicaid provider enrollment webinar. That's going to be a pre-recorded webinar, and it should be out very soon. So if some of these questions, wheels are still turning and you still have some unanswered questions, just know we're trying our best to answer the ones that were given to us regarding provider enrollment today, but we will certainly take them as well and consider them and address them in the webinar that's going to be forthcoming on provider enrollment. Okay, our next question is, some programs that bill Medicaid, such as Bridges to Health, do not have an MPI number, and should this be acquired? And Joyce, I think you kind of answered that. The MPI number will need to be acquired for purposes of billing for managed care plans. It's on the claims form. So we're trying our best just to make sure that providers have all that they need in place for when we're moving to the new world and thinking about what managed care plans are required, what their preferences are and what they require for billing.
So how to get an MPI number will be in that pre-recorded webinar that you just read.
Yeah.
Okay.
Yep. We'll show the website and we'll have screenshots and we'll give guidance both to agencies that need to require an MPI number and to individual staff that need to require an MPI number. And that goes on to our next question. Will each specific staff providing SPA or HCBS services require an MPI number? And the answer to that is yes. Each agency will be required to have all staff have an MPI number, and this again ties into managed care plans require this on their claims form, and it's really for tracking purposes to see what provider provided what service, and this goes for both licensed and unlicensed staff. The MPI guidance that we will be showing on that webinar will show exactly where an unlicensed individual would need to go to obtain an MPI number and where a licensed individual would need to go to obtain an MPI number. Okay, so these were the questions that we received from Monday's webinar, and again, if there are questions that were sent within the mailbox between Monday and now, we will certainly screen for those and we will add them to our FAQ document. And we have about 10 minutes, so we can quickly take a look at our chat box and see, with the help of all our state agencies, if we're able to answer some questions.
We also got an email, if it's easier for you to see.
Oh, there's an email, okay. Bear with us one, yeah.
Oh, no, while you're getting situated, there's a question that I can answer quite easily. One of the questions was regarding SPA and HCBS services. Can one manager oversee and supervise both programs, or are there firewalls necessary? I just want to clarify, the issue regarding conflict of interest or conflict-free case management is really in regards to a care manager, so that would be a health home care manager or an HCBS care manager, and HCBS services. So SPA services are not captured under the HCBS rule regarding conflict of interest. So they are direct services, and so there would be really no need to separate out service provision. So SPA services and HCBS services can be supervised by the same manager. That same manager, however, should not be supervising any care managers that are in your organization. So any health home care managers, or for the purposes of preparing for the future, I would also suggest that they wouldn't necessarily supervise any HCBS care management as well. And I know many existing waivers already have those separations and firewalls in place. Some of them don't, but will soon, speaking for OMH. So it's really the separation between the care management function and any direct service provision, particularly regarding HCBS. State plan services are not captured under the HCBS rules, so those are not really an issue regarding conflict of interest or conflict-free case management. So I hope that's helpful.
There's a question, how do you suggest agency staff for these services as they are not programs? There's no way to anticipate referral, and therefore staffing configurations are hard to anticipate. Can you provide some thoughts on this? This is a really good question. Obviously, there's always fiscal viability concerns, and when there's new services like this coming out, it takes a while to kind of learn the ropes. If you're a provider who is a smaller provider, or you have some fiscal viability concerns within your agency, I caution you to take a little time, put together a team, really look at what the costs are associated with the staff once the rates are released. Try to do some projections and fiscal modeling, but I would encourage you to start slowly, and then as you have, more volume and more services, then you can add staff time to that.
So, and I think these are great questions for the planning of providers in this process. I think the fact that the application is not going to be due until April, these are the types of things that you absolutely should be thinking about. I think Tiffany mentioned on the provider designation webinar the other day is that, nobody should be hiring anybody right now. These services still have to go through approvals with CMS. And so the staffing and the hiring is something that should be part of your thinking and part of your planning, but not part of your doing. But it shows that you're thinking in the right direction, and please take this time to review the application and the services and manuals and take everything into consideration before you apply and complete the designation application on April 1st. Okay, so we have a number of really good questions. They're a little bit complicated, which again goes to show the sophistication of how you all are thinking and exactly the questions that you should be asking. Many of them do require us to confer with our state agency partners that are on the call, and as I said again, unfortunately we weren't able to be in the same room today. So I think that we're going to take the opportunity to really take all of your chat questions, which we've not gotten to today, and confer with our state agency partners to assure that we develop comprehensive and clear and effective answers to your questions. And we will include them on the Q&A that we issue on the DOH website in regards to the provider designation process. And so I think with that, we're going to be ending today's call, but we are going to be taking all of your chat questions and we're going to be integrating them into the Q&A document after we've had a chance to develop the answers and responses with our state agency partners. McTack, do you want to close this out?
Absolutely. Thanks so very, very much to everyone who joined today for sending in great questions. To echo the sentiment, we'll be following up in the coming days and weeks with resources around some of the questions and answers in development, so please stay tuned for that. Again, the slides and recording from Monday's designation webinar and a recording of today's office hour will be available in the next coming days. We'll be sure to include links to those in our weekly digest next week that goes out on Monday morning. So stay tuned, and thanks so much to all for a fantastic office hour, and we'll see you next time.